everyone, this is MBBS Gallery. Today our topic is coronary sinus. So what is coronary sinus? It is the largest vein of the heart and is situated in the posterior side of the heart, especially in the left posterior coronary sulcus, and it is about 3 cm long, and ultimately it ends into the posterior wall of the right atriums. So it has several tributaries. They are right marginal vein here and the great cardiac vein here, and this is supposed to be in anterior side of the heart, and the posterior side it has a 4 more tributaries: the posterior vein of the left ventricles, an oblique vein of the left atrium, and small cardiac vein and middle cardiac vein. So let us see the tributaries little more clear. Coronary sinus. The coronary sinus is the largest vein of the heart. It is situated in the left posterior coronary sulcus. It is about 3 cm long. It ends by opening into the posterior wall of the right atrium. It receives the following tributaries. They are great cardiac vein, middle cardiac vein, small cardiac vein, posterior vein of the left ventricle, oblique vein of the left atrium of Marshall, and right marginal vein. Finally, the clinical significance. Let us see about cardiac vein, great cardiac vein. The great cardiac vein is situated here. This is the great cardiac vein. So it firstly it accompanies the anterior interventricular artery. Here this is an anterior portion of the heart, so here runs an anterior interventricular artery. This great cardiac vein actually accompanies the anterior interventricular artery, and then circumflex artery to entire the left side of the coronary sinus. This is the left side of the coronary sinus, this is right side of the coronary sinus, and this is the middle of the coronary sinus. So from that, on that posterior side, it comes and enters into the left side of the coronary sinus, after accompanied by anterior interventricular artery and the circumflex artery. So it receives the left marginal vein from left ventricles. Then middle cardiac vein. Here is the middle cardiac vein. So the middle cardiac vein accompanies the posterior interventricular artery and joins middle part of the coronary sinus. It accompanies the posterior interventricular arteries. Here this is anterior interventricular artery here, the posterior interventricular artery, and joins the middle part of the coronary sinus. Here it joins the left part of the coronary sinus. So then small cardiac vein. Here is the small cardiac vein. So it accompanies the right coronary artery in the right posterior coronary sulcus. This is the posterior side of the heart, and this is the right side. So there is a coronary sulcus. So right posterior coronary sulcus, there is a right coronary artery. This small cardiac vein accompanies the right coronary artery in the right posterior coronary sulcus and joins the right end of the coronary sinus. Yes, we already know this is the right end of the coronary sinus. This is the middle of the coronary sinus, which is joined by middle cardiac vein, and this is left end of the coronary sinus, which is joined by great cardiac vein, and small cardiac vein joins into the right part of the coronary sinus. The right marginal vein may drain into the small cardiac vein. Posterior vein of the left ventricle runs on the diaphragmatic surface of the left ventricle and ends in the coronary sinus. This is the posterior vein of the left ventricle. This is the posterior surface of the heart, and this is a ventricle, so we call it as a posterior vein of the left ventricle, which directly drains into the coronary sinus. Oblique vein of the left atrium of Marshall's. This is the oblique vein of the left atrium of Marshall. It is actually a small vein running on the posterior side of the left atrium. This is left atrium, posterior side of the heart. So small vein running in the posterior side of the left atrium. terminates in the left end of the coronary sinus. Here, because this is a left end, it develops from the it develops from the left common cardinal vein or duct of Cuvier, which may sometimes form a large left superior vena cava. So, oblique vein of the left atrium of Marshall is, it is a small vein running in the posterior surface of the left atrium. It terminates in the left end of the coronary sinus. It develops from the left common cardinal vein or duct of Cuvier, which may sometimes form a large left superior vena cava. And finally, last tributary, the right marginal vein. This is a right marginal vein which supplies the anterior part marginally. It accompanies the marginal branches of right coronary artery. It accompanies the marginal branches of right coronary artery. It may drain into small cardiac vein or may open directly into the right atrium. So, and then finally a clinical significance. Here, retrograde cardioplegia. What is retrograde cardioplegia? It is a term used to refer to delivery of cardioplegic solution via a catheter inserted into the coronary sinus. Cardioplegic solution via catheter inserted into the coronary sinus for the purpose of myocardial protection during cardiac surgery. Thank you.